Hi, everybody. This has been this has been a hard week. This has been a heavy week. I have seen a lot of people struggling, and I wanted to send this message out because I'm right here with you. This isn't easy. This is really, really hard. I have seen so many people struggling, from babies to kids to parents to grandparents. And I really felt it on my heart to send out a message to let you know that you're not alone. But more importantly, this last 14 months, we have heard so many stats and numbers, and the news has been constant, and it has put so many people into a state of fear. And I wanted to switch that conversation to hope. And more importantly, I wanted to talk about health, because we haven't been talking about health. And I wanted to talk about some things that you could do for your health so that you could be more confident in your health. So the first tip comes from actually the Journal of British Sports Medicine, and it was talking about exercise. And it found that any patients with COVID who had exercised prior to being sick were less likely to be hospitalized, to have severe symptoms, or to be admitted to ICUs. So this is important. So generally, an adult should exercise between 150 and 300 minutes a week of moderate exercise. So on that minimum, that's 5 times a week going out for a 30-minute walk. We can all do that. We can fit it into our schedules. We can do it with our dog, with our kids, with our partners, with our friends. We can get outside and get that exercise. So not only is that going to provide an immune boost for our body, but it's also going to improve your mood. It's going to improve your energy. It's going to improve your quality of sleep. It's going to help you maintain a healthy weight. Exercise is crucial for our health. The second tip is supplementing with vitamin D. So again, tons of research in the last year has found that a lot of people that have been challenged with COVID have had a vitamin D deficiency. Now, where we live north of the border, we don't get a lot of sunshine for a whole lot of months of the year. And so a lot of us are deficient in vitamin D. Now, of course, the weather is changing and the sun is coming out longer and we're getting outside more, but not even everybody can get outside more. So it is really important that we supplement with vitamin D drops. And it is easy. It's inexpensive, and you literally throw a couple drops in your water, under your tongue, in your smoothie, whatever works for you. Your kids can do it, you can do it, your elderly parents can do it, and it is going to make you healthier. So much so that I am going to stock it in our office in the summertime so that patients can have even easier access to purchase it so that they can supplement in their families from the fall to the spring. And that is a staple in this house, and I want it to be in your house as well. The third tip is learning how your nervous system works. So when we are under prolonged stress, which is the last 14 months, our body gets stuck in sympathetic overdrive, which is kind of like the gas pedal on a car. Chiropractic helps to increase the tone of your parasympathetic system, which is like the brake pedal. Now imagine if you're always living with this gas pedal pushed right to the floor, that's kind of like living in survival mode or fight or flight, or thinking that there's a bear in the room. And when that's happening, all this stuff that your parasympathetic system is in charge of, sleep, healing from headaches and back pain, mood, your immune system, digestion, that stuff isn't working as well. So we need to balance those two systems so that your parasympathetic system has better tone, so that you are able to adapt to all those stresses, so that all of those functions happen a little bit better. So there you go. 3 easy tips to make sure that you can have more confidence in your health, so that you can be happy, so that you don't have to live in fear, and so that most importantly, you can continue to live this thing we called life. Have a great day, and reach out if you have any questions.